the idea of the project is to work the impact of interventions, vaccination strategies on the transmission of COVID, and in particular on poor regions, right? It's to consider the different levels of socioeconomic conditions in Brazil. So that's our objective. In order to understand, right, it's kind of complex, although it's simple, the idea to understand that the poverty influence on the spread of the disease. But when we put in the table what we need, so we need lots of information. So we have data about the clinical conditions of patients. Of course, our data that's not identified, right? So we know the number of cases. If this case, we know the age group, or if there is some comorbidities, like clinical epidemiological features of the patients. So we have this type of data. We have also data about mobility, intercities, to understand a little bit more about human behavior, about like mobility in the city. So like we use Google Mobility. We have parameters to estimate the level of economical conditions, education, economical conditions in the municipality. In order to associate our study with poverty, we use this data set. We have also data about the strategy of vaccination. So we know levels of people who are vaccinated, age group, type of vaccine, if they get first, second dose, if already getting booster, and so on. And to complete, we have also data about the governmental measures that have been applied in each state. So we can follow a bit the pattern of restrictions, right? And associate this with human behavior and then try to put all together. So these are the three or four main type of data that we have: health, human behavior, poverty, and the measures applied. Vaccination and the non-pharmaceutical intervention. The biggest challenge is, first of all, the update of data in real time, because we know, right, so this different set of data, they update in different moments. So the best scenario would be that we can follow this all together. And another problem that appeared that we didn't foresee before was that depending on the states, depending on the region, especially if it's a poor or rich region, the update of the data is different. Of course, poor region is more affected. So following real time the pandemic is complicated, especially in the population we are more interested, which is the vulnerabilities and the vulnerable people, right? And the second issue is about scientific divulgation. So we want to do a project that influence on get fast answers, right? We wanted to finish pandemic. That's the end. And we have 1 year of project. And the objective is that we produce some results that can immediately be applied and try to reduce the poor situation, and I mean the critical situation we have in Brazil. And we noticed that scientific divulgation is very crucial, and we kind of rebalance our work in order to produce material for this scientific divulgation, because people are, unfortunately, they are not adhering as it is. And when relaxing the measures, for them it's like the pandemic finished, and it's not. And then the problem comes again, and then it's way more difficult for readapting all the modeling, all the things. So we saw that scientific divulgation is really a challenge, and the real-time update of data as well. So I would say that mainly the impact is to improve the quality of life of the people, especially the poor one. We wanted to finish this work and to guarantee that the measures that we have to improve the quality of life and avoid mortality and case on the poor people must be applied as soon as possible. So we want people to be vaccinated. We want the vulnerable people to be vaccinated, because we know they are the ones who most die, right? So that's the main thing that we're working for. I mean, we have experience last year for doing that, and somehow it was successful, right? And with this grant, we are making it more broad, and we have this opportunity at least if we do a little bit and we can change 1%, it will be really a lot. So that's the main part that we want. Improve quality of life and guarantee that the vaccination strategy and the non-pharmaceutical, which can be also, can cover more the vulnerable population and provide to the community like all the results, visualization, that the material that we are producing, right? So we are already having results. I mean, we are planning that by the end of November, we already have the which we call like the main core vaccination strategy that we have. We separate in 2 parts because it was getting very long. So you know that in poor countries, like in mid-low, actually in low countries, well, let's say, right, the main thing is to reduce hospitalization and reduce mortality, right? So we already have a type of model which we understand the dynamic of the disease and how it influences on this hospitalization and mortality. So we now created a model with we can plug the vaccination strategy, right? So we by the end of November, we wanted to finish first paper which describe the parameters, because we have data of the clinical conditions. So we can estimate the period of hospitalization previous and after vaccine. We can estimate the mortality. We can estimate many parameters, like for the real specific conditions of certain regions, and use these in models. So this is going to be very, very good, like really very good. So this is like we're planning to have by the end of November. We already have the model, and we hope that we can already implement this first model. We want to study for each state by the moment, also to do not be too much long the results. And then after in the visualization platform, we implement everything. And then the person can go even for the city and try to understand the situation there. This is the main things. And the map of risk. The map of risk, actually it involves like a statistical and Bayesian modeling. So what we are planning, the first sketch is to have what we call the raw analysis. It's the level of descriptive. So you can make a descriptive analysis of the risk of the disease in each municipality. And then later that we are going to implement more the Bayesian modeling. But that's it. So parameter estimation, we also have the documentation, like a data briefing for the whole data set, which also contains some descriptive analysis and highlight the importance of the data set, the potential, what else we can do that can go beyond the project. And this thing about vaccine, that's the main results that we are obtaining now this month of November. Let's suppose at least that the data sets, they are available on time. Okay, so let's suppose that. So there are several limitations on data which appears because of problems of notification. For instance, we have now the data set of mild and mild moderate case of COVID, and also the severe case of COVID. About 52% of the severe case of COVID, they do not have a final classification. So for sure, it's case of COVID, right? Because we know there is a under notification, sub-notification. But I mean, we cannot wait so much to have this data set like clean and proper for use. So one type priority would be algorithms that can improve the data, so the quality of the data, right? So classification algorithms to better like approximate the number of cases to the reality of the disease, not to work like, for instance, the measures that the government do, the non-pharmaceutical measures also, they are text. We need to create codes to understand the text and categorize and do. So all these tools that can be used to improve data in this stage that we are, I think would be one priority, because right, we have already a lot of data set, let's say, and projects like ICODA, they are collecting all these data set. So one priority would be like improving the quality of the information. And a second priority would be in the end. So this is the data at the beginning, right? And then they go the whole flow of analysis and so on. And the second would be the scientific divulgation. So it is one thing that we were not used before, and which is still, I would say, even by myself, I'm a mathematician. Most of things I was doing, it was really for the scientific community, and sometimes even just for mathematicians, statisticians, let's say. But I think it's crucial now that we learn how to pass information, how to be more, have more the feeling, the human feeling of how the manage they need the information, how the population need to understand it, you know. So we can make it effect, like have models, have results that will really be effective and right applied. So I think these two, the two, like beginning and end, they are important. The main priorities, I would say now. Yeah, I wouldn't be doing work without data sharing. I wouldn't. Like I would be doing simulation, which is like it can give insight, but it doesn't apply to reality if you don't apply to the data. So it would be just abstract ideas. Like I think all the work would be nothing. I do visualization, I do scientific divulgation, I do modeling. So without data, this would be nothing for the pandemic. Nothing. So it's the first thing that is for our project, which is crucial, is data sharing. I can say that, but actually it's not so much. It's that now I kind of got some not collaboration, still it's early, right, with people from India. It's a professor, statistician from India, and we see that for instance, this opportunity I'm having now with this project, for me it was really a dream that we can have a team of people working in different things. Like we are very interdisciplinary and produce something. And when I was talking with this group of people in India, I felt that it's like, when you have a kid, you have the kid and she has a candy in the hand, and then the other kid does not have. You wanted to give. I wanted just to I don't know, to join and say like, you can do the same for India. Let's find out the data. Let's try to do the same, because we know we have similar problems, we have similar issues. And so what I feel that maybe would be something nice is that opportunity to have more, not only national but international, like front, right? More to have more this global idea. And yeah, I hope that you people find out somehow way to cover this other group, India, some Asian countries, right? African countries. You're already doing that, but I mean, we know that the limitations of the resource is not so much.